Hello, Christa Heibel, CEO of CH Consulting Group, and I am here today with my dear friend and colleague and business partner in crime, Michael Lamm from Corporate Advisory Group. We're excited to be back together. We ran into each other at a conference in Las Vegas. Um, we've been running into conferences and working with each other and knowing each other like that for a very, very long time. And we wanted to just kind of connect. We're almost halfway through the year here. We like to stay on top of what's going on in the industry and the market together. And today we want to talk a little bit about some business trending and some healthcare topics, right, Michael? I said that.
That's right. That's right, Krista. It's great to be here. I love talking to you about all things that relate to the industries that we play in. And I wanted to spend time today just kicking around all the stuff going on in healthcare because it's changing. It's healthcare doesn't change quickly, as you know, but it's starting to, which is cool to watch, but it's got a long way to go when it comes to data, call center work, everything in between. So I think we've got a bunch of things to talk about today.
It's really timely because I'm actually on a couple of different our company's working with a couple of different healthcare um, providers right now, and so yes, I feel like that is a topic rich environment for us. And I like, just so everyone knows, we were just chatting for a minute before we started the recording. We have not really discussed this conversation. So this is part of what I love about Michael is that we just get on and share insights, trending, things we're seeing, things we know are working, not working, and really want to keep that just real for all of you that are going to take the time to listen to this conversation. But yeah, healthcare, let's do it.
Yeah, so Krista, here's my view on where what I'm seeing. And like I recently had to take my son in for a healthcare procedure, a hospital procedure. We had to go to the emergency room. He had all these issues. And it was not fun. But I did notice that for the first time that when you go to emergency room, nobody ever expects it, the process is getting slowly a little bit better. They actually like listen and talk to you and say, "Wait, do you have insurance? Do you? Why are you here?" And here's the process that you should be going through before you even enter the emergency room, which years ago wasn't the case. So kudos to healthcare in that regard. That I feel like it's beginning to get a bit better. People are beginning to understand from the patient side what it's like to go through the hospital, the healthcare system, and how painful it could sometimes be. And I think that's opening things up for a lot of companies that we're seeing when we're at the last conference and others there that are doing some pretty interesting work around how to fix some of the big problems that exist in healthcare today.
Yeah, and listen, they are big problems. I share with people the more we get into healthcare, and that's been a pretty major industry for us for the last 5, 6 years now. I feel like the whole thing is a little bit of a deck of cards, right? I mean, the whole healthcare ecosystem and how it's structured and really has evolved over the last 60, 70 years I don't know that it's really maintainable in current state, like financially for the consumer or for the healthcare systems. So listen, we're part of some of that transformation, Michael, that you're seeing, right? We've been involved in a lot of what we call access center projects. I feel like what is kind of happening is we've always felt that healthcare is a little bit behind on some of the best practices around CX or PX, if we want to call it there, in that space. And so now they're catching up, and they're catching up because they're catching on to the idea that part of the PX or CX game is revenue. Because if I can't get in, if I can't get a hold of you and I can't get an appointment scheduled, I'm going to call the next dermatologist opportunity or clinic or the next primary care clinic, and I'm going to take my business and my dollars somewhere else, right? So there's this interesting thing that we see happening within healthcare and the provider side of that, where rev cycle is now getting and a little bit more matured from a PX perspective, right? Because a lot of the traditional healthcare rev cycle pieces overlap with traditional customer experience or patient experience touch points within the registration and the scheduling process. So
Do you
it's
remember,
not easy.
but Krista, like think about it. Like we do a lot of M&A work in valuation work and revenue cycle. And I remember like going back, like how impossible it was to figure out scheduling. And just finally, over the past few years, they're starting to realize that as you said, the patient has options, right?
Yeah.
Like
Yeah.
if they can't get through to the dermatologist or whatever it is,
Yes.
they're going to go find another dermatologist because they're
Yes.
like, why am I going to screw around with
Yes.
a physician that I can't get in touch with to make an appointment? It's just not. It's not. The world has shifted, which I
But,
think is pretty cool
I
to watch.
don't healthcare didn't want, my so as an outsider coming into this space more aggressively in the last 5 to 6 years, my business never went after that market. I cannot claim to have had a brilliant healthcare strategy that broke me into that space, and we've worked with some significant providers, not, and insurance companies, clinical, trial, pharmaceutical pharmacies, but they came to us because they really literally were looking for contact center customer experience best practices, and they need to be, Michael, you're on the acquisition and merger side of this space. There's a lot of activity happening right now, and so just within the Minnesota Wisconsin market where I'm corporately headquartered and where I have some current clients, there's some shifting, and they're getting nervous about what the other one's going to do. So now the focus is on this access, right? This patient experience piece, but the resistance is on the clinical side. I think healthcare for a long time did not want to look at themselves like a business. They're saving lives. They're doing something more important than that, but they are a business and they have a P&L and they have financial oversight and accountability, right? Number two, the resistance on the clinical side is real. Dr. Jim in Department X has been golfing on Tuesdays and Wednesdays for an extended lunch period for a very long time. And Dr. Jim does not want an enterprise contact center with standardization and access to the schedule because Dr. Jim's got to give that up a little bit, right? So when you come in and you look at patient experience and access and how to make that all better, you have to address, like anybody, same thing with the bank, same thing with the retailer. Where is the back office? Where is the clinical side of the house? And lack of standardization, lack of visibility into processes or productivity holding back that improvement on the front end. And that is a real deal in healthcare providers.
No
It's a
doubt,
real
and the
struggle.
the the, the clinic, it's always been that way. And your analogy of Dr. Jim is 100% real and has issues, but Dr. Jim may ultimately turn into Dr. Robot at some point, Krista, and
Yeah.
maybe that's going to make
Yeah.
things easier because at the end of the day, even when I drive around Philadelphia and I look at the posters of Mainline Health and Jefferson and all these different players, they're all the posters that you see when you drive by are all these happy people, the community, everyone loves
Yeah.
their hospital system. But it's not always the case. And there's
No.
a lot of issues that they need to wake up to the reality that they are a business and they've got to think about the patient or the consumer, or they're not going to continue to be serviced there.
Yeah.
They're going to go somewhere else.
Yeah, and it's really, listen, we're talking 101. Okay. So from we are business consultants with expertise in customer experience, the science of the contact center operation, because it is a data-driven science part of an enterprise organization, regardless of vertical, right? And the tech that supports that. And they are really behind on all of those fronts. um you know you can't benchmark yourself in healthcare against healthcare. I literally just got into this conversation. We're very blessed to work with some really phenomenal healthcare system consulting companies that advise our clients on things outside of the matters of our expertise, and we partner right on solutioning. But they were asking me for healthcare benchmarking, and I said I don't do healthcare benchmarking. I do customer experience benchmarking. Because if you go benchmark yourself against the other healthcare company that's also not meeting the consumer's expectations on any of the baseline research, we're talking basic SLAs, Michael. Speed to answer and a certain percentage of calls without abandons. I mean, we have healthcare clients where the rest of the markets are running abandonment at under 5 or under 3%. We're seeing healthcare running still post COVID spikes and big problems, still running maybe 8, 10, 15% abandoned. This is baseline CX KPI, not acceptable. And somehow they've been really justifying that to themselves in that space for a long time. And they're losing revenue. We have case studies all the time of individuals and patients that either go elsewhere or just don't book the appointment. And that's even more alarming, right?
No, but that's the name of the game. But a lot of our clients are doing like the front end, the patient registration, capturing insurance data, figuring out if they're eligible, Krista, for Medicaid eligibility or whatever or welfare programs. All of that, they're just beginning to streamline. A lot of this is outsourced.
Yeah.
It's not done inside the hospital, the physician group, but more and more so, they're bringing in AI and other tech in order to support these processes. Thankfully, because they're seeing what's going on in other areas of financial services. It makes no difference whether hospital A benchmarks themselves against another hospital. They're failing already. They've
Yes.
got to benchmark themselves against, as you said,
Yes.
against another market that is performing well
Yeah.
as a way to kind of
Yeah.
justify what they're doing.
Well, we're like benchmark against what the consumer expects. I mean, CX is about the customer expectation, right? The experience they're having is partly based on the expectation they have. So if you're not meeting expectation, I am automatically having a bad experience. Do you see where I'm going? So, like we explained to healthcare over and over again, CX research says speed to answer, speed to service, accuracy, first call resolution, don't waste my time is an expectation as a consumer. And none of that research says, oh, don't waste my time when I want to call order a pair of jeans, but please waste my time when I'm trying to book a doctor. No, no,
Right.
all the same benchmarking and metrics need to be in
I
place.
think the other big thing that we're seeing a lot of companies trying to they're trying to solve for it, but it's very hard is data, right? There's
Yeah.
so much data on you, me, and the fence pole when you go to the physician, go to the hospital. How much of that data is actually being utilized for the models that are driving AI? Not really. They're not even there yet because of HIPAA and all the other requirements. But can you imagine if it gets there? So when we're sitting there and we're like, should I or the registration or they already know that your insurance is expired. It already automates, populates the
Yeah.
information, and then oh by the way, it then knows that you got to go in for your routine physical, and you're already getting a message well before that happens to schedule it, and it ties into your calendar. So I feel like the more it goes there, the more it's going to create opportunity for the revenue cycle management vendors, the contact centers, the data companies that are trying to support this ecosystem once we can figure out how to pull the data and analyze it in a better
Yeah,
way.
no doubt about it. And listen, you're seeing moves within the healthcare EMR, medical record system, providers like Epic already trying to help solve for some of that, like omni-channel, digital, non-voice communication, proactive communication, right? So but listen, one of the problems, though, fundamentally from our perspective, when we look at solutioning this, and it doesn't matter if you're healthcare or anybody else, you can't get in front of best practices from a resource management, process design, and tech stack strategy to just go do AI, right? So healthcare is a little more cautious around AI stuff because of some of the HIPAA and compliance and security pieces. We say be cautious, but there's a lot of internal facing AI under the umbrella of CX and the contact center that can be utilized to, like speech analytics tools, like performance management, coaching, LMS, QMS type systems, and of course now agent assist tools, right? So there are things that can give you AI, give you some efficiency gains, show operational improvement, and show overall improved patient experience or partner, because it's not just the patient, it's providers and the whole ecosystem the hospital supports, right? By using AI on internal contact center operations before you even have to get into like chat bots and stuff. SMS automation is obviously there around scheduling and a lot of that, which is good, and you should be there already. But you can't go do automation from an AI external perspective if your call center operations isn't even set up right anyway. Like there is no QA and they don't know what WFM and workforce management even means. Like the literal organizational structure that makes a contact center is often completely absent in this environment. So they may or may not be on the right technology. We have found recently some providers that are like running on decent, CCAS platforms, have some QMS WFM tech there, but they don't know how to use it, right? They don't have the processes and the organizational structure set up. So lots of 101 low hanging fruit, immediate ROI and patient experience improvement opportunities in almost every one of these places we walk into.
Yeah, I think that's why there's a big growth potential in healthcare and in AI and tech. It's just it's gonna we're continuing to see more investors, more Silicon Valley folks coming in and coming up with really interesting ways to solve these areas. Like the biggest area that we play in is just the patient financial responsibility side, because
Mm.
nobody knows how even a bill is calculated today. I don't care what government,
I know.
Congress act that gets put in place. Still, nobody can read a healthcare bill and figure out why am I paying eight $800 at the end of all of this.
Yeah,
It's difficult, and they've got to begin to solve for that. And
yeah,
a lot of that starts up front, Krista. It's like
yeah,
you go in, you know what your insurance is, you know what your deductible is, and there's probably a good likelihood at the end of it, here's how much you're going to owe. Wouldn't you like to
yeah,
know that every time you walk in the door versus it
yeah.
being this vague guess of what it may or may not be, and then, oh, by the way, I don't have the $800, so what do I do now?
And then a heart attack when the bill comes and another medical bill to follow.
And then
Yes.
and then 90 days later you get a bill about something else.
Yeah,
Those are all real day-to-day dynamics that the average human being in America has to experience, but it doesn't for have to be like that forever,
yeah,
which is where this this world of healthcare and RCM just continues to need to shift. And that's why I think it's exciting that you've got a whole new crop of investors and buyers kind of all looking at it from a tech perspective
yeah,
to do stuff
yeah.
here.
Yeah. Well, I mean, listen, that's good because I think, I feel like in the case again of just going back to the customer experience PX piece and contact center operations, efficiency and the tech, they have to bring people from the outside in to help them advance that, right? And I think that that applies over the overall technology, all like there has to be some inserted from outside healthcare perspective to help move healthcare along a little bit. So it is exciting to see some of the investment and again the A&M and some of the moves happening because some of the money behind that is going to bring some of that business perspective, I think, and force some of this, I hope, right? Like kind of efficiency gains and
I
optimization.
just can't stand how slow it moves. And I know I've talked to executives in healthcare all the time, and it takes forever because of the hierarchy, the decision making tree. for anything to move forward. And I get it, these are complex workflows that need to get solved and worked on, and it doesn't happen overnight. But man, it just it bothers me so much that we have so much talent and expertise around some of these areas outside of healthcare and areas of financial services, telco, that could
Yeah.
be leveraged to make it so
Yeah.
much more faster and more efficient.
Yeah.
But it never seems to get there.
Yeah.
Is but
Yeah.
I don't
Yeah.
know.
Yeah. Well, and you talked about data and oftentimes like even outside of healthcare, we I would say statistically probably 70% of our overall clients are not looking at all the data we feel like they should be from an operations efficiency and or P&L and or customer experience measurement perspective. There are always data gaps or data integrity issues, and really data is king, right? Data really is what should, I keep trying, if you don't understand the contact center, let me tell you, it's all about data. Data should be driving strategy. It's a performance management constant feedback loop culture. That's what the contact center really is all about. So that goes to not only having the right tech in place, which often is not there because of the lack of true contact center CX expertise within these organizations, but also knowing how to use it and set it up, really set it up properly, right? So you have the right data integrity to manage all of these aspects of opportunity.
But I think Krista too. I think you're 100% right. I look at like as people continue to age, and you're providing more healthcare at home, and you're not doing it in
Mm.
the hospital or the physician. You're doing it from the home, and then you've got to have all the data to support that, the work to handle the workflow of that patient that's got to know that they've got to take that prescription, or know that they've got to be able to go back in, or they're going to have somebody come in for physical therapy or rehab or whatever it is into the home. And
Mm.
that is a whole other data set that's not in office, in the clinic, in the
Yeah.
hospital, that we've got to contend with too.
Yeah, yeah, yeah. We've worked with a lot of those home service models, so that is interesting because it adds like a whole dispatch element to the whole solutioning as well. Yeah.
Do you think we're going to eventually have like, like you and I will have a healthcare robot that sits alongside of us that says, Krista, you need to take your medicine today. Michael, you got to go out and walk around the block because your blood pressure is too high. Like, you think we're going to get there?
I don't know, when you said that earlier, it kind of made me go, "Whoa," but why yeah. I mean, yeah. Yeah.
I
And
do.
and
I
probably
I think it's going to
in
get there.
certain cases on like more common or easier to diagnose things, it may even have improved accuracy over some of, right there. I mean, there are medical error rates, so I think that's a really fascinating idea. I've often wondered if the model, even though we see a lot of like merger happening right now, I almost feel like the model has I goes back to more privatized,
Yeah.
like more personalized, privatized. Like I just I think the consumer in general misses the like having a doctor that knows them, right? There's something lost in translation from the old, you had this primary care doctor, Dr. Johnson. I think Dr. Johnson in my hometown like birthed like a very significant portion of our population, right? But like you would know Dr. Johnson your whole life, right? Or significant portion of it. And so when Dr. Johnson became part of a larger, geo organization, that really changed. And so I guess I was kind of holding out hope that we might be going back more into that direction, right? Because these larger providers have been creating what I call more of a hub and spoke model. They come in, they acquire these clinics and hospitals. In rural areas, they pull the specialties back. often to one more localized area, right? Which takes services out of a lot of rural areas. Like it's not really progress, but it's better P&L. It's also partly healthcare shortage. I
Yeah,
don't know, the whole P&L side of that business as a serial entrepreneur and business owner like fascinates me.
I know, but then all of that's true. But then you go, people are looking for speed, right? If you
Mm,
have a health issue, you want to go to the urgent care, the clinic, whatever it is, right? And do it quickly, fast, and not have any real questions. They're not even going to a primary care physician. They're going to an urgent care clinic to get, if they have
true.
whatever they've got,
Yeah,
strep
true.
throat, pneumonia, a common cold, whatever they're dealing with. They're not even wasting the time trying to go set up an appointment with
Yeah.
Dr. Johnson. It just
But
isn't,
but
you
that's
know,
part of the problem too, though, because access to those elements of healthcare operationally are more expensive.
they
And
are.
now we've got the whole financial. What was the statistic, Michael, I learned in the last couple of years? I did not know that. Is it 20%? I should know this number. Like 20% of non-insured revenue is actually collected by a provider.
Yeah, it's
So if my insurance isn't covering it, whoever shows up insured, they're collecting the insurance money, but the payer part of that, the patient pay part of that, and all the people that show up with no insurance, 20% I think is collectible. It's no higher than 30. No business could run who could do that? Could you run
who no,
on collecting
you
not collecting
can't.
20, right?
You can't, and that's also a part of the where our world of patients think about. They're like, oh, it's free. It's not free. We all have businesses to run.
Yeah.
Healthcare is a business too, and
Yeah.
it's got to operate as such. But I feel like over time people are going to are living longer. That statistic is there. We're things are really happening in healthcare that are very positive in terms of where the patient experience is going. It just
Yes.
could be so much better than what
Yes.
it is today
Yes.
if it was if they benchmarked it
Yes.
in a different
Yep.
way than they're
Yep.
doing it right now.
Yeah. Just basic. I mean, really, literally, Michael, in every healthcare client we are active in right now today, as you and I are videoing this, they are missing basic baseline CX and contact center processes and best practices. It's not earth shattering stuff. There would be significant improvement if we just brought those baseline best practices into that vertical more aggressively.
I think too, though, going back to data, Krista, the data side of healthcare being how compliance focused it is. Could you imagine going to the bot scenario that I described, where every consumer, every patient has that healthcare AI bot that's sitting next to them, that's also helping deal with, oh, I don't have the $800 to pay. Well, then
Yes,
the bot figures out how you're going to pay that $800 based on your financial position.
yes,
So it does pay, it does get paid
yes,
in the right
yes,
way because they
yes,
don't have the 800. They have $200 a month to pay it, but it
yes,
does get paid versus it go to zero. And
yes,
I think to me, I feel like that's where another big opportunity between CX and just where the tech is going to combine all of that. And
yeah.
I think there's a big opportunity there too.
I think we had worked for a large, very large national provider. This was several years ago on some of these issues. And they were in Florida. They're not only in Florida, but they had Florida locations. And I believe back then, doesn't Florida have a transparency in pricing state
Hmm.
law around this? I really thought that would catch on. Like I really thought that would be rolled out and become the thing because if the consumers demanded that transparency on the front end, like that's the one call type you never hear. You never hear somebody calling in to say, "Hey, I need to make an appointment with my OBGYN. When is she available and what is the price on that?" Right?
Never. but even Krista, with the No Surprises Billing Act, and it's transparent, it's still complicated. It's
Yeah.
still impossible to figure out, even if you know what you're talking about, or knowing any part of healthcare. It's going to always have its complication because of the insurance process that we go through,
Yes. Yes.
and it's just part of what it is. But the more education, the more financial wellness, the more stuff that gets produced, where people can start understanding what it's like to say, wait, I do want to know what that appointment's going to cost. Like,
Yeah.
just give me a sense of that so I can make a
Yeah.
decision on what I'm going to do. Yeah, I need the whatever the appointment is, but I do want to know what it's going to cost. And that concept has been thrown out the window for a very long time.
Yeah. Yeah. It is fascinating. We are very grateful at CH Consulting Group to be a part of all of this. So again, we feel like we get to walk in, and often, if the executive leadership team is truly committed to improving their financial customer experience, access center, contact center model from a CX and a P&L perspective with the right processes and tech and data, we get to look like heroes, because again, it's really starts with a lot of just 101 validated for decades best practices that can really make a significant difference, and we love being able to come in and do that, because we're all patients, because we're all, to your point and your private story at the beginning of our conversation around what you experienced, like we're all going through that together, right?
Yeah,
And it can be significantly better.
it can be so much better. And I feel like that's kind of the name of the game
Yeah.
for those that want to listen and improve, those that are in the position to help make it better.
Yeah.
This is where they've got to be willing to listen and understand what else is out there. I'm
Yeah.
sick and tired of getting from hospitals, executives, and other people that I've interacted with, well, we send out surveys and we get survey results back. I'm like, okay, that's great, but how many people are completing that survey to give you any actionable insights that are going to
Yeah.
do anything that's going to
Yeah.
change how you're managing your process? Probably very little,
Yeah.
because nobody's focused on that.
Michael, if you want to talk about voice of the customer, voice of the patient experience, two healthcare providers right now, both with a fully deployed Calabrio platform for full QA and speech analytics, and nobody turned the speech analytics on.
There you go. Wonder how much that costs. Like these are millions of dollars of decisions that are being made, and people are deploying stuff that,
And in that case, that, I mean, listen, speech analytics is the beginning in many ways to the path
yeah,
of better CX and the financial optimization and the AI strategy, right? The amount of data that you can get out of that. So yeah, it's just yeah, data, lots of opportunity.
and for me, I mean, on the M&A side, in the valuation of the revenue cycle area is booming. It's growing. People need these vendors to support the hospitals and the physician
Yeah,
groups because of how screwed up it is. and,
yeah,
and they live and breathe off of that, which is great. But I think there's so many more steps we could make to make the improvements trickle down to the average patient or the consumer today.
yeah, no doubt. Well, I hope that we both get to continue to kind of be a part of that evolution. I hope you and I can find some ways together to work together towards some better goals in that space. Because listen, I mean, what percentage of our overall GDP is healthcare? Like 40? It's something wild. It's really, and it's not really sustainable in the format it's in. And the impact is very, very far reaching. Personally, for Americans, and financially for our entire market.
Yeah, yeah,
What do you
no
think about
doubt.
it? Yeah. Cool.
Well, Krista, as always, this has been a pleasure kind of bantering around our frustrations and opportunities that are
Yeah.
out there in healthcare. I think it's immense for those that play in it. I really
Yeah.
do.
Yeah, and listen, for those of you that have listened and followed us here to the end, I think Michael and I would both love to know what you think. So please take time to make a comment, throw your thoughts on all of this. It's again it's a big and important discussion, I think, to all of us as again patients and consumers and Americans. So I'd love to know where you're at in your personal journey, or if you're in the industry, where you're at in your thoughts about what the future looks like or what we need to be doing. Reach out to either one of us directly. Love to have that conversation. So
And also tell us if you don't agree. Tell us if you
yeah,
think there's that healthcare isn't as broken as we're talking about. Maybe there's
yeah,
other a diamond here that we're missing, Krista.
yeah,
But I don't think we are. I think a lot of people feel the way we do, and I think that's what creates the reason to change it
yep,
in all these different areas.
yep. I agree. Great. All right. Everybody have a good day. Thank you.
Thanks.